Guys, welcome to my channel once again. My name is Uba Chamakamercy. I'm your host as always. Thank you guys so much for watching and for subscribing. Please don't forget to tap that subscribe button once again and share to your family and friends. Turn on the notification button so that you can always be notified when I post a new video. So I've been doing a series on STDs. So today the video is going to be a little bit lengthy. I hope I make this very interesting and fun for you guys to watch. So without much waste of time, let's get into the main video. The first one we're going to be talking about today is staphylococcus. Staph, the most common and the most talked about infection that we have all been hearing about. Okay, so in Nigeria here, staph is regarded as the cause of every problem, be it a chronic cough, be it malaria, be it whatever it may be. The herbalist will always tell you about staph being the root cause of your problem. Of course, I know that's not true, and that's a lie. Just the people who want to believe them decide to do so. Okay, so about 25% of people normally carry around staph infection all over their body or in their body, but they do not know about it. If you recall in my former videos, I told you about something known as normal body flora. So staph can actually be located in your nose, in your eyes, in your mouth, in your saliva, under your pits, in your genital area. It can be located in places where you can just swipe through and you can get little moist from. So that's mostly it about staph. Okay, then staph infection ranges. Okay, note staph is not an STI. Staph is not a sexually transmitted infection, but most people will confuse it as actually being a sexually transmitted infection. It's not. Okay, so staph can actually be ranging from boils, cellulitis, rashes. I know most of the times when we have boils on our skin, staphylococcus infection, okay, happening, okay, and causing damage on your skin. So how can you actually get the staph? You can get staph by exchange of body fluids or normal skin to skin contact with somebody, sharing your towel, sharing your undies, your clothes, anything at all that can actually absorb moist or water could actually transfer staph to you. Okay, so here's the reason why I said staph is not a sexually transmitted infection. For a disease to be counted or categorized as a sexually transmitted infection, it means it has to undergo skin to skin contact. Okay, so if there's no skin to skin contact in the genital area, it cannot be called staph. Of course, it cannot be called sexually transmitted infection. I beg your pardon, because something that is transmitted through sex means genital intercourse, skin to skin. Okay, staph can be treated with antibiotics, but nonetheless, some bacteria can actually be antibiotic resistant. That's why you should go to the hospital, not just a lab. Go to the hospital so that you can consult the doctor, and then they can carry out a test on you and find out the main bacteria. So from finding out the main bacteria that's the cause of the problem you're having, then a particular drug can be prescribed for you to deal with that bacteria. All right, let's go on to the next. Next up, we have chlamydia. So chlamydia is a sexually transmitted infection. Yeah, I know you all were waiting for me to say that, and I have finally said it. So chlamydia is a sexually transmitted infection, and most people, especially the men, do not show symptoms of chlamydia in the early stages. It takes up to weeks or months for most men or most individuals to show symptoms of being infected with chlamydia, which is called being asymptomatic. Don't forget, I've said that in my videos before. So if you have problems with that, please kindly rush to the hospital and get yourself tested. But before that, let's look into causes of chlamydia. So causes of chlamydia: unprotected sex, be it oral sex, be it genital sex, whatever it may be. So far as it's unprotected, it could also cause you chlamydia. Yeah. Okay. Even masturbation could also cause chlamydia. Masturbation, fingering of any sort. For the people who are married, whenever you dig your fingers into that place without properly washing, it could also lead to having chlamydia or being infected with chlamydia. So please, let's observe proper hygiene before we do whatever we want to do. Even if I know some people might say it could also spoil the mood and all that. All right, newborn babies could also be infected with chlamydia if the mother has been infected with chlamydia before birth. So chlamydia could be transferred to a newborn baby during birth. Okay, now one of the rare cases of chlamydia is that chlamydia could also occur in the eyes. But like I said, it's a very raw case and it's mostly sometimes you don't see it. Okay, so it's very rare, like I said before. Now, symptoms of chlamydia: most men do not notice that they have any symptoms of chlamydia at all. They do not even know. But watch out for these symptoms. Have a burning sensation when you're passing out urine. You have yellowish or greenish discharge. You have pain in your testicles. You have pain in your lower abdomen and your waist. Please, testicles, I'm sure every man should know what testicles is, but for those that do not know, that particular sac that comes behind your organ is your testicles. Okay, that's what it is. That sac, like it's two. Okay, that's what your testicle is. All right, now for the ladies, let's look at their own causes and symptoms. When you have chlamydia, you experience the following symptoms: dyspareunia, that's painful sexual intercourse; bleeding in between periods; discharge, yellowish discharge; pain in the lower abdomen; and also pain at the back. So another name for chlamydia is the silent infection. Chlamydia can be a silent killer. So someone might say, okay, so what if I don't experience these symptoms at all? I think it's best for you to visit the doctor regularly. Yeah, you should do that. Even if you don't have any symptoms of anything, regular checkups and tests will also help you in a very, 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 very large manner possible. Okay? Complications of chlamydia. Untreated chlamydia could also cause PID, known as pelvic inflammatory disease. Now, symptoms of PID: we have fever, we have severe pelvic pain, we have nausea, we have abnormal vaginal bleeding. Okay, now chlamydia could also infect the rectum. When I talk about the rectum is located at the inner part of your body, that part with the rubber that mostly contracts and dilates for poop to come out. Yeah, that's where the rectum is. Yeah, I know you might keep your face like that's disgusting, but I'm serious here. Okay, now women could also develop throat infection if they have sex with somebody who has already been infected with chlamydia. Symptoms of chlamydia infection in your throat could be fever, sore throat, cough, and the rest. So it's important that you also go for regular checkups, as I have said before. If I have chlamydia, does it mean any other thing will happen to me? No, don't be scared. Chlamydia is completely treatable. You can always treat chlamydia with the antibiotics that the doctors are going to give you at the hospital when you go for checkup. Careful not to let sexually transmitted diseases linger for a long while, because it could cause a lot of damage, and damage is going to be very, very bad. Now let's talk about trichomonas. So trich is caught by a protozoan organism called Trichomonas vaginalis. So I'll say it again, Trichomonas vaginalis. So it travels from one person to another person through genital contact, of course, without the barrier method, and sharing of sex toys. So in both women and men, it causes infection in the vagina and also in the uterus. Unlike staphylococcus, trich cannot be transmitted through hugging, through kissing, through handshakes, or even sharing of wet or moist things and all that. Okay, so but for trich, there has to be direct contact of the genitals or oral contact. Okay, so without that, it cannot be known as a sexually transmitted infection. Now, what can actually increase your risk of having trichomoniasis? Multiple sexual partners, having unprotected sex, having unprotected oral sex, sharing of sex toys, and the rest. Okay, so symptoms of trichomoniasis: heavy mucosal discharge, which can have the consistency or look like mayonnaise, lower abdominal pain, frequent urge to urinate, pain at the back, pain at the waist, you know, most times if you're not careful as a lady, you could mistake it for pregnancy, but it's not pregnancy because of frequent urge to urinate. That's not part of it. But if you're having all these symptoms, it could also be trich. So it's good for you to run quickly to the hospital to get properly checked and observed to make sure that it's not actually what you're facing or what you're going up against. Okay, so untreated trich, just like chlamydia, could result in PID. Once again, pelvic inflammatory disease. It could also lead to infertility, blockage of the fallopian tube, and scarring of the tissues in the body. It could also lead to redness, swelling, inflammation of the cervix as well. Okay, so the cervix is the mouth of the womb. That's what it's called. It's not the mouth of the vagina though, but the mouth and the entrance of the womb. That's what it's called, the cervix. If you have trichomoniasis, please try as much as possible to get it treated. Some women could also have trichomoniasis and also be pregnant at the same time. I would advise that you see the doctor and he will know the exact drugs to give you. Don't be scared. It does not mean that the drugs could end up, killing the baby or aborting the pregnancy. It's not true. There are some antibiotics the doctor can also give you because trich is 100% treatable. It only becomes very difficult to treat when it has overstayed and stayed for a long period of time because it could as well be asymptomatic. Now, mind you, trich could also increase the risk of contracting other STDs and STI. It could also increase the risk of contacting HIV. So let's be very careful and mind you. I was talking with someone yesterday and he said, why should I use a barrier method when I'm with my wife? No, when you're using a barrier method, you're not only trying to prevent pregnancy, you're also trying to keep your partner safe from any other infection that you might have come across with. If you're a man or a woman and you know that you might have used a public urinary, please, before you have or indulge in sexual intercourse with your partner, please try as much as possible to use a barrier method. Then run quickly to the hospital and consult your doctor. It will not take you anything. I know maybe seeing the doctor in a hospital could be expensive, but your life is at stake here. So you should take your life as serious as possible. It doesn't matter how much it takes. It's just your life we're talking about here. Nothing much, okay? So please remember to always get yourself regularly checked. avoid unprotected sex, okay, and make sure you do everything right. Lastly, I want to address the issue. Most of the times, women go through a lot of problems in their marriage, because they feel they are unable to have kids. Do you know that most of this problem comes from the man? Yes, it comes from the man. But what happens? He blames it on the lady and said, yeah, he saw the people you have been with in your previous time, in your past time. That's what you've been doing. That's what is going on. Why do you always end up doing this? Why do you always end up doing that? No. If the lady has gone for a checkup and it's discovered that probably she has an infection, then it will become that the lady is the cause of the problem. But that is not true. It's also the man, because he must have had an infection and he refused to get to the hospital on time to get it treated, and it might have caused him infertility as well. So please, let's all live in peace. Let's all live together. Try to avoid whatever it is that will cause trouble in your family and in your life. Okay, so with that, we'll wrap up today's episode, today's special edition. Please don't forget to like, don't forget to subscribe to my channel, send this video across to your family and friends, keep them educated constantly. Okay, don't forget that the aim of making this video is to promote, protect, and prevent illness through awareness, and that's what I'm doing here. I'm always here to educate you on any health issue you can think of. So once again, I love you all. We are family. Stay safe. God bless you.